Okay.
And maybe I'll share my screen then for the presentation. Is that okay?
Yeah, let me give you control, make you co-host. How about that?
Okay.
Okay. Both you and Amelia and Blake, you guys both want it to be co-hosts or just one?
I can do it.
Are
Just
you gonna-
Amelia. She's our lead clicker over there.
You lead clicker. I like that one. Our lead clicker. Okay, darling, this is amazing. Okay, let me see. And I'll just go here.
Let's see. Uh-oh, does that look okay?
Let me see.
Is it
It
zoomed
looks
in?
good. I just can't see the title.
Okay.
But the rest of it's okay.
All right.
Try clicking one forward and see if we, oh, there it goes. Oh
Oh gosh.
my gosh, we're fancier than we even knew.
Unexpected, unexpected.
Oh,
Okay.
Okay, well, are we good to get started, Amelia?
yes.
Is that
So today we have Dr. Blake. Should I say Dr. Henley? Am I right? Yeah.
Either are fine with me.
Either one. Okay. Who he's gonna be here doing a presentation for us, pregnancy and first timer, and also we have Amelia, who is also one of our not first time MD, but she's also one of our supporter and a community member, MD, who is also going to be presenting this presentation today. Welcome to Mommy's Corner. Mommy's Corner here, we meet up every Saturday, as you all know. Mommy's Corner is part of GBS. Mommy's Corner was actually born like almost right after the pandemic, and it's been, flourishing. And we've been meeting up every Saturday around 5 o'clock, and it's basically educational platform where we educate moms and all women of different walks of life about pregnancy, postpartum mental health, and even our own women who are running for seats. We invite them actually to come here and to announce their position, what they're running in, what is it for. So basically, Mommy's Corner became this huge, platform where women can gather or even just come together and just to talk basic things like back to school stuff or just, mommy things. Because being a mom and being a woman, it's huge. You know what they say, it takes a village to raise a child, right? So it starts with us. So yeah, and GBS has been nice enough and amazing, to have this segment and to sponsor Mommy's Corner since the pandemic. So it's nice to have doctors from our own community to come out and to educate women about their anatomy and their body. And now we are going to be talking about babies, my favorite subject. So I'll welcome you and you guys take over. Thank you for coming today.
Thank you so much for having us. We feel so grateful and honored to be invited to speak with everyone. So thank you so much.
You're so welcome. And those who are joining us, please, thank you so much for taking the time, to join us and to spend your weekend with us, part of your weekend. If you have any question, please put it on the chat, or, you can basically raise your hand. And those of you who are in Facebook, you can put it on the chat and then we'll answer your question as we go along.
Lovely. Yeah, thank you so much for the warm welcome. I'm really excited to be here. Like we said, it's actually my first time coming to Mommy's Corner, but I've heard incredible things about it. And um, so I think we'll jump in. I would also like to preface that I'm an intern and Dr. Gallagher is a chief resident with us. So I give her full empowerment to interrupt me at any point if at some point I'm, giving any sort of misleading information. She's the kind of end all be all here. But I'm just like, I'm so lucky to be able to work with her and work with all of you. So what we're doing right now is we're starting with a 3-part pregnancy series. We are doing the first trimester, second trimester, and third trimester. So today is our focus on pregnancy in the first trimester.
There we go.
So, so just as an outline of what we wanted to talk about today is all of the things that we have patients come in and ask us about when they're in their first trimester of pregnancy. So the first thing is just basic nutrition and exercise, and how it might be a little bit different from when you're not pregnant. The second thing is probably one of the more common is morning sickness, and one of the less comfortable, definitely, of that first trimester. The third thing we want to talk about are things to avoid, and this is often what you have relatives telling you to do, and or not to do. And we have a list of things that are very evidence-based that we want to just highlight and chat about. And then lastly, what to expect on the medical side of things. So that's when you first come in for your pregnancy evaluation, what you can expect in that first visit, and then what we'll be screening for, labs you'll be doing, just what to expect, because that first visit can be very overwhelming. So kind of knowing ahead of time, I think, is really valuable. So we'll jump right in. So the first thing is nutrition in pregnancy. And we emphasize this a lot with our patients at the beginning, and we kind of took a step back of maybe patients don't know why we're so adamant about this. And a few major reasons are it's not only valuable for baby kind of in the now as baby's developing, but also throughout the remainder of the pregnancy. So like any growing creature, the baby needs certain nutrients that might not always be available in your diet. And kind of longer term are, the sequelae of blood pressure, or hypertension and diabetes issues, concerns like that. And there are certain foods that we can lean towards or avoid to prevent those more complicated pregnancy elements in the long run. And then lastly, there are some foods that we recommend people avoid altogether as they are very dangerous to pregnancy. So we'll talk about those right now too. So what we have here, and I think you can see it okay, this is from the Oregon Health and Science University, basically a summary of what we should be doing, for just your general eating. And this is the pregnancy plate. Things we want to highlight is when you look at this, it is kind of in general what we recommend everyone eats, high vegetables, high whole grains, and protein. In particular, what we wanted to emphasize is the vegetables. I think that is not always the easiest thing to consume, but making sure that, very starchy greens such as broccoli and carrots, even cabbage, are really valuable during pregnancy. And then things like protein, which again, we'll get a few of the elements on here, such as exercise and protein, we'll talk a little bit more about. But Amelia, do you have anything, or Dr. Gallagher, do you have anything you want to add to the pregnancy plate recommendations?
I think there's some things that we will highlight a little later, talking about nutrition to focus on, and then also just to focus on getting calcium and vitamin D is also really important to include in diet. So, sometimes dairy, sometimes finding vegetables that are high in those things can be helpful for the growing baby. Then.
So the biggest thing I think women hear about when they're trying to get pregnant or become pregnant is about folic acid. And that is, we have a list here of foods high in folate, and they're on the left hand of your screen there. But we still see that when, regardless of eating these foods high in folate, there still might not be enough of the daily requirements for baby. And so that's why we always recommend some sort of folic acid supplement. It's in every prenatal vitamin or gummy or anything like that. And the recommendation is 400 to 800 micrograms daily. And we recommend starting that even before pregnancy. And the main reason is that this helps with baby's brain and spine development. And it makes sure that that entire canal that baby is forming is closed. And folate is just an interestingly very important element to that development. And like we say on here, it is in all prenatal vitamins because it is one of the most important vitamins. So if that's not on your radar yet, folic acid or folate is one of the #1 recommendations for pregnancy. And then the other thing that we chat about is iron. And I think of iron as kind of necessary twofold. Well, #1 is for the pregnancy and for baby. It requires more iron. It's an element in the body that is highly utilized in pregnancy. And then reason #2 is blood loss in pregnancy is very common. We want to make sure that we're not in any sort of anemic or low blood level situation as we're approaching delivery. So from the beginning, we like to keep track of your iron and make sure that you're have adequate blood levels. So a major way to do that is to just kind of focus your diet a little bit on iron. So the list here is great. So things like egg yolks, oatmeal, spinach, I recommend a lot, and meat, of course, has the iron. And during the first trimester of pregnancy, we do iron screening and we check in on where iron levels are. And if they're at a point where we are worried about it, at that point we can start talking about additional supplementation. But usually through diet, patients can get their iron levels to where we would like to see them. And if not, we have a lot of options to help. And then fish consumption. This has been a topic in the media for years about whether or not pregnant women should be eating fish and or what type of fish. So we actually have data that 2 to 3 servings per week of fish can improve neurodevelopment in children, and it actually lowers the risk of preterm birth. So we do recommend fish consumption. The exception of that is mercury content. So the most publicized high mercury content is tuna, but other things such as shark has a high content, tuna, marlin, orange roughy, swordfish, and all of the types of tuna. So those are the types of fish to avoid, but things like, oh, perfect, thank you. Here are the ones on the left-hand side. So salmon is one of our favorites to recommend, trout, oysters, anchovies. The ones that have a little bit of a higher mercury index are in the middle in that yellow. And then the red are the ones I just talked about. So swordfish, shark, orange roughy, tuna. And you can see there are 2 different types of tuna. I usually just recommend to avoid tuna, but I don't know about you, Dr. Gallagher. What do you recommend?
It depends on like if it's canned and shelf stable, I think it's okay. If it's something that's more like fresh caught and like something in sushi, like maybe avoid that.
And this is, I've actually had a lot of conversations with patients about what types of foods are safe in pregnancy. So if you have any questions or anything is confusing to you, feel free to ask us today or your provider at any point in time. We're more than happy to help with that. And then when I was talking about, things to avoid, Listeria is a bacteria that is pretty dangerous to pregnancy, and I think a little bit less known about. So Listeria is a bacteria that grows in some foods. It can make you sick, and it's particularly dangerous to babies. So the symptoms aren't super significant. It kind of feels just like body aches and a little bit sick, but it can cause miscarriages, preterm labor, stillbirth, things like that. So the foods that we recommend all pregnant patients avoid are any soft cheeses, so that's like the bries and things like that, raw sprouts, melon, lunch meats, hot dogs, and raw milk. So that's the unpasteurized milk. And again, that's because those all can be host to Listeria, a type of bacteria that is dangerous to mom and especially baby. And then exercise and bed rest. This is another one that I feel like pregnant patients ask about often, is how much exercise should I be getting? What's appropriate? What's safe? Both from, a health standpoint and from a baby standpoint. And so we typically recommend almost the same thing that we recommend for other individuals, which is 20 to 30 minutes of exercise 4 to 5 times per week. The exception that I tell patients is like, we're not training for a marathon at this point. We're not doing heavy lifting. We're keeping it moderately safe and moderately easy. So you should be able to talk through the duration of your exercising. And then what we always say is like, don't bump the bump. And that means that there's anything that puts your belly at risk of like being struck by something heavy, such as like lifting or anything like that, including like contact sports, if you're on a soccer league or anything like that. We recommend avoiding those for the duration of the pregnancy, mostly because while your belly is a very safe and protected area for baby, outside forces can still cause some trauma. And then bed rest was a topic of conversation that has again been popular in media, and whether or not bed rest is a good idea. And I tell patients, unless your doctor has explicitly sort of prescribed bed rest for you, and that would be in the event of some sort of like third trimester concerns, bed rest is to be avoided. And the main reasons is that data shows it doesn't actually prevent preterm birth, miscarriage, bleeding, or growth problems, and it can increase your risk of getting a blood clot. So I think overall movement is good for both mom and baby. And then the other thing that we wanted to talk about was weight gain. And this is, again, another thing that patients commonly ask about. I've included a table here. It's kind of small, so you might not be able to see it. This is our recommendation of, weight gain throughout pregnancy. So overall, depending on what your weight was before you were pregnant, the recommendations for how much weight is safe to gain or recommended to gain during your pregnancy varies, and it also depends on whether or not you're having one baby or twins, etc. So, and those numbers are listed there. Again, this is something your provider will go over with you in detail, and it is very patient specific. But the sort of summary is in the first trimester, we don't actually expect significant gains, and actually we recommend you eat very normally. You eat how you were eating before, so it's the same amount. And we acknowledge that morning sickness can make this really hard. So it's, for a lot of patients, it's the first time that, kind of eating how much they normally were is really difficult. So that's where I recommend, talking with your doctor and seeing if there are strategies to sort of mitigate some of that morning sickness, and finding whatever food you can get that will at least keep that calorie consumption that you're at before at the same level. And then we'll talk about this more in our second and third trimester conversation, but at that point you will start increasing the amount you eat, and the amount you're craving and the amount you need, your hunger levels will also change then as well.
And just to add, and we'll talk about this later on in our other talks too, but there is this sweet spot of weight gain in pregnancy. On one hand, it's important to gain weight so that you're providing enough nutrients and energy to the baby, and that you have enough energy. And so it's important to gain enough weight. It's also can be dangerous to babies to gain a lot more than what's recommended. So sometimes that can increase the possibility of getting diabetes of pregnancy, or having high blood pressure problems, or growing a really big baby, which is harder when you come to delivery, and can be harder on you and your body, and also can cause some, possible risks to the baby when it's born too. So there's kind of this balance in this range that's in the healthy range, and that can be good to try to stick to, but it can be really hard too.
Mhm.
And so, kind of going off of that, and what Dr. Blake was saying is, morning sickness is such a common group of symptoms and problems in the first trimester, especially. And it can definitely lead to difficulty keeping food down. And at the most extremes, it can cause even weight loss and dehydration and be an emergency. So, some home things that can help are eating frequent small snacks throughout the day, avoiding an empty stomach, which can sometimes make nausea worse, making sure you're having small sips of drinks like water, tea, like herbal teas, to make sure you're staying hydrated and lessening nausea. Finding any foods that sit well with you and sticking to those foods and avoiding foods that and smells that can make you feel sick. And some things that can be really helpful when you're feeling nauseated are things like ginger teas, candies, lozenges, that can really help with nausea. Some of the medications that we recommend that are very safe in pregnancy are vitamin B6 and then doxalamine combined with vitamin B6 are some things that can be prescribed as well that can really help with the nausea and vomiting and are extremely safe in pregnancy. Sometimes they're not as helpful though, so they're not. If some people find that they don't work well for the nausea and vomiting and still have issues with it. If you or if you are having nausea and vomiting that isn't working with these treatments, it's important to go talk to your doctor about next steps that you can try. There's some other prescription medications that are safe that we don't always like to try before any of these other options, but they still are safe and safer than becoming dehydrated and losing weight. So that's a balance that we try to get into too. And then in the most severe cases, if this is something that you're going through and you're feeling dizzy, you're feeling like your heart is racing, you're noticing that you're peeing less, or that your pee is a really dark color, or you're unable to eat anything or drink anything for 12 hours or more, that's when we get worried about your safety and we recommend calling your doctor or going to the emergency room, and you might need fluids to help hydrate you through an IV. And sometimes people who have kind of very, very extreme cases of this need to have kind of regular IV fluid infusions at their clinic. And luckily, that's rare. That's the rare and severe end, but some people do experience that. And so that would be when to seek emergency care. So other things to kind of avoid and the data behind them. So some common things that people use when they're not pregnant, and we get a lot of these questions of what's safe and how much is safe. And so one thing, especially being in Seattle, is caffeine and what is safe. So something that is hard is knowing exactly in pregnancy what is safe and what limit is safe. And as doctors, sometimes we have trouble knowing exactly the right number because there isn't a lot of research studies on pregnant women. But we think that low to moderate caffeine intake is safe. So you don't have to completely cut that morning cup of coffee or tea out. We recommend 200 to 300 milligrams a day maximum. So not going above that limit. And different doctors might recommend different numbers. Some doctors might say don't go above 200. Some people say don't go above 300. There's kind of some mixed recommendations out there. And one thing to keep in mind with that recommendation of those number of milligrams of caffeine is that different coffee brands, different restaurants have different strengths of caffeine. So one 16-ounce coffee or one 12-ounce coffee might not have the same milligrams of caffeine as the next one. So it's also important to talk to the people making your coffee or looking at the coffee beans to find out exactly how strong what you're drinking is, or the tea. And then tobacco is another thing that can be common that people use before pregnancy. Cigarette smoking is something that is pretty risky to pregnancy. It can cause poor growth. It can cause miscarriage. It can cause early labor and delivery. But if you are someone who smokes and you find that you're pregnant, it's also pretty hard to stop smoking, but nicotine patches or gum, nicotine replacement is okay. And it's important to replace the cigarette smoking with nicotine if that's what you need to do to stop smoking. so that you're reducing the exposure to the other toxins in cigarettes, and reducing secondhand smoke as well. So that is something that is safe. And then some people choose to vape tobacco, and that's something that's relatively new, and we're not sure exactly the effect that has on pregnancy. We know that it does have a lot more nicotine in it than the nicotine patches or gum, so we would probably recommend trying to switch to something that's a little lower concentration, like the patches or gum. Other things, alcohol is something that um, all health organizations recommend no alcohol intake during pregnancy. But there is a lot of conversation about this around the world of how much alcohol is safe. We know that a lot of alcohol, that there is an effect on babies, that it can cause quite serious developmental delays, growth problems, even problems with certain organs like heart, vision, and bone growth. There can be some really devastating effects on the baby with alcohol use, but we don't know how much alcohol causes these problems. There have been lots of studies that show that someone can have one alcoholic beverage a day, 10 alcoholic beverages a week, and that there hasn't been any bad outcomes in the babies. But we don't know exactly. And it's not something that I think that we can say, oh, what having one drink a day will definitely be okay. So it's hard for us to say whether a little bit's okay or whether, but and as doctors, we kind of recommend probably avoiding it altogether is the best thing to do. Um, Another thing that some folks use is marijuana, and this slide's a little messed up, but we do know that the active ingredient in marijuana, THC, does cross the placenta and is in breast milk. We don't know how it affects the baby though. There has been some ideas that it might cause slower development, some behavior problems once the baby is growing and growing up outside of you, growing in as a child. We recommend avoiding it, and we don't really know if it does cause problems or if it doesn't. So it's hard for us to say, but probably it's the safest thing is to probably avoid it. Another thing that sometimes comes up is asking about things like swimming or hot tubs. And one thing is that in general, the idea of having an increased maternal temperature, so your body getting very, very, very hot, can be a little dangerous to your pregnancy. So it can increase the risk of miscarriage. And that is something like if you're jumping into a hot tub that is, over 100 degrees Fahrenheit, that's when your body's getting that hot. And so we recommend avoiding hot tubs, but drawing a bath and being in a bath that is warm and not boiling hot is safe. Also, swimming in pools is safe as well and can be a nice form of exercise during pregnancy. And then along the same lines of if your body gets very, very hot, like if you have a fever, taking Tylenol can be safe and help prevent any sort of bad outcomes from having your body be very hot. So, it's important to, people get sick during pregnancy as well. It's important to talk to your doctor about that. And taking Tylenol can be helpful to prevent any sort of bad outcomes. So, the next section I wanted to talk about too was going to your doctor and what you might expect at doctor's visits and why we might be recommending certain things and what we're thinking about when you come and see us. Because sometimes I think we have our little list of to do things and checklists, and I don't know if we share that or if we talk to patients about what to expect as much as we should. So I just want to demystify that a little bit and answer some of those questions. And of course, if there's questions at the end of this, we're happy to take them and answer anything that might come up. So you think you're pregnant, you might have been trying to get pregnant, and you take a pregnancy test at home, or you weren't trying to get pregnant, but you're feeling some symptoms and you take a pregnancy test at home, or you just think you're pregnant. Even if you take a pregnancy test at home and you're positive, once you come to the doctor, we're going to have you leave a urine sample and a pregnancy test in our office as well. So that's the first thing we do. That first doctor's visit is actually not your part of your prenatal visits. That is called a missed period visit. And that's when we're just confirming that you're pregnant or not pregnant. The first real prenatal visit is so some other things that we're looking at in kind of in these doctor's visits in the first trimester is the main thing is we're trying to get a good history and get a good understanding of what risks or problems might develop in pregnancy or might develop in labor or delivery. Another thing we're doing in these first visits is establishing your due date and making sure we have a good idea of how far along you are when you present for care. Another thing we'll talk about in this talk is genetic testing. And then the other thing we like to do is, as we were talking about before, just help with symptoms and help with making sure you're generally healthy during pregnancy. So I kind of jumped ahead, but in the first visit, we confirm the pregnancy. And then there's this first prenatal visit that is kind of covered under the insurance coverage for your entire pregnancy and postpartum course. So that's the first visit. We know you're pregnant, we have you come in. And for us, this is kind of a big visit. We are going to be, and the entire goal is what problems can we predict that might come up and how can we prevent them? We want to make sure that you are healthy and your baby is healthy during this pregnancy and that you have an uncomplicated pregnancy, an uncomplicated labor and delivery, and that you have a happy and healthy baby at the end of it. So those are our main goals. And we, in this first visit, we're going to ask a lot of questions. We're going to get a big history from you of understanding what your health is, if you have any health problems, if you're on any medications, and if they are safe in pregnancy. If you have any family history of any problems that might impact your pregnancy, or you might be at a higher risk of having those health problems because it's in your family. We want to know if you've been pregnant before and how that pregnancy went, or if you've had delivered babies before and how those deliveries went, and if there were any complications or problems. If you've had some sort of problem in your past pregnancies or your past deliveries, we think that you might be at a higher risk than the general population of having this happen again. And so we might take steps to talk to you to do extra tests or recommend extra things like extra screenings or ultrasounds or things to make sure that we can maybe prevent something from happening that might have happened in the past. Things like bleeding, things like early labor, things like that. We will also do a physical exam and see if we see anything that we might be concerned about for the furthering of your pregnancy. We also do a lot of lab work in that first visit. So we do a lot of blood tests. What we're doing with those blood tests primarily is we're looking for any infections. Sometimes if we're not pregnant, we can be carrying some infections that we don't even know about, and it's okay. But if you're pregnant, it might actually have a bad impact on the baby. So we do a lot of tests to make sure that there's no infections that you're carrying that might impact baby. We also check, like Dr. Blake was saying, about blood levels to make sure you're not having anemia or that you don't have any blood problems that might affect the baby or the baby's growth. And then if you have a history of something like diabetes or high blood pressure, if you've had any of those things in past pregnancies, then we might do some extra testing to make sure that we're keeping a closer eye on those things. And if you've had any exposure to infections, like if you've traveled somewhere that has tuberculosis or Zika virus, then we might do some extra tests to make sure that you aren't having those infections either. So the first trimester ultrasound is something that we also schedule during that first visit. There's two main reasons that we get that first trimester ultrasound. One is we want to know how far along your pregnancy is when you come to see us. And one important piece of information for that is when your last period was. But some people have irregular periods or aren't quite sure when it was, and sometimes it's hard to keep track of when that's happening. So the ultrasound can also be a really accurate way of knowing how far along your pregnancy is. It is the most accurate between 6 and 9 weeks of pregnancy. Before that, it might be so small that we don't necessarily see the things that we can measure. It might be so small we can't measure things correctly and accurately, but between 6 and 9 weeks, it's very accurate. After 9 weeks, it gets a little less accurate the more weeks you go. And then about 18 to 22 weeks along, if you're getting your first ultrasound after that, it's pretty hard to know. It's a little less accurate. It's more like it could be 2 to 3 to 4 weeks different from your actual due date. And the reason is that in the first trimester up to like 16 weeks, babies kind of grow at the same rate. Babies grow at the rate of how old they are. So every 8-week baby is about the same size. Every 9-week baby is about the same size. But once you're around 16, 18, 20 weeks, that's when big babies start becoming bigger, small babies are smaller, and medium-sized babies are medium. So when you're in your second trimester, if you're 24 weeks along and you get your first ultrasound, if your baby is a certain size, we wonder, is that how old your baby is, or is your baby big because it's going to be a big baby? And it's hard for us to know exactly how far along you are. So that's why we really recommend, and we think it's important for pregnant folks to get a ultrasound kind of in the first trimester. Around 6 to 9 weeks can be the most helpful, but even before 16 weeks can be very helpful for understanding what the dating is. The other important reason we like to get ultrasounds in the first trimester is when you get a pregnancy test positive, that means that there is a pregnancy in your body. We want to know if that pregnancy is going to successfully grow into a baby and if your pregnancy is what we call viable. Um, you can have a pregnancy that's not in your uterus. And if it's in your uterus, we think that it's more likely that you're gonna be able to grow a baby and deliver it. If the baby is in your fallopian tube or elsewhere in your body, it's actually very dangerous to grow a pregnancy there, and it can be an emergency and cause lots of bleeding and pain. And so we wanna make sure that the pregnancy is in the right spot in your body, the spot that in your uterus that was developed to grow a baby, and not other places, because if it's other places, that can be really dangerous. So we want to know about that. And the other thing is we can see if the baby is doing okay and if there's a heartbeat. And that's another important thing we want to figure out in those early weeks, whether this baby is doing okay and is going to continue growing.
And Dr. Gallagher, just to add one thing
Mhm.
to that slide, I just want to add, we included the images of kind of what the ultrasound looks like, is because I've had a lot of patients come in the first trimester and they're expecting that picture of baby where you see the head, maybe even the little hand, and in the first trimester, we really don't see that. And what we're looking for are very small little changes in the uterus, and that's what we're measuring. And that's what like Dr. Gallagher said, is we have a great frame of reference of kind of the stepwise process of the growth there. But really, if you look at kind of the sequence of events from 4 to 5 weeks, you can really only, and please excuse all the medical jargon below this, but the first 4 to 5 weeks, you only see like a dot on within the uterus to confirm whether or not there's a pregnancy. And we continue to follow that. And it's not until about 8 weeks that you start to see anything that even kind of resembles possibly the development of fetal tissue.
Okay, and then the next thing we wanted to talk about was this question of genetic screening. So what is genetic screening? Why do we offer this to people? Why would someone want to get genetic screening? So the way I like to think about it is it's something that we offer every pregnant person that comes to the doctor. It's something that we can help to see if your baby is at higher risk of having some sort of genetic abnormality or defect that might um, impact whether this pregnancy is going to be able to continue um, through to birth, whether this pregnancy might be at a higher risk of a miscarriage or a stillbirth because of some sort of abnormality genetically. Um, and and it can help tell us if the baby is developing kind of in a normal way, or if there's some sort of kind of issue going on that might cause it to be um, something different from that. So that's what we offer it to everybody. It is something that is always up to the patient, the pregnant person, and their families of whether they want to screen. It is not mandatory at all. Of course, none of this is. um, and it's something that's a conversation. So some people choose to get this screening because they want to know whether or not there's something that could impact their pregnancy or their baby, and that they might choose to end the pregnancy if there was some sort of abnormality. Some people want to do the screening because they want to know if there's any sort of problems or any differences, but they know that they wouldn't change anything at all, that they would continue the pregnancy and they'd see what's going on, but they would maybe be a little bit more prepared, that knowing that there was a higher risk of something going on. And then some people choose not to screen and don't want to know if there's going to be any changes, and they're not going to do anything differently. So that is something that is usually a conversation between the person who is pregnant, their family, their doctor, and is ultimately completely up to you of what you might choose. The tests that we can offer don't even tell us for sure if there's going to be any sort of abnormality. They tell us if there's a higher risk of an abnormality. They kind of give a percentage of, you might be at, an 80% risk of this baby having some sort of like a Down syndrome or a different type of genetic problem. If there is an abnormal result on these tests, then there are other tests that are more invasive that you can choose to have done that are actually diagnostic to say whether or not for sure this pregnancy has some sort of abnormality. And so what are these different screening tests, the one that say whether you're at a higher risk or not? So there's a lot of different ones. The cell-free DNA test is something that you can get starting at 10 weeks, and you can get that any point in the pregnancy after 10 weeks. It's a blood test, and it measures that there are some fetal blood cells that are released through the placenta and into your bloodstream, and we can measure those in the lab. It also tells us what sex the baby is at that point. But it's a pretty expensive test, and it's usually only covered if someone is 35 years or older when they're pregnant, or if there's any family or personal history of any sort of abnormalities, so a higher risk to start with. Other screenings are a little bit more accessible and for everybody. And the first trimester screening is a blood test and an ultrasound. It measures certain components in the blood that might show that there's a higher risk of some sort of abnormality, and then an ultrasound that shows whether or not there are any changes or to the baby's body that might look like there's some differences in the way it's growing or developing. And that is something that can be done between 10 and 14 weeks. There's also a second trimester screening between 15 and 22 weeks. That's also a blood test and an ultrasound, but the blood test measures for a couple different things. And the ultrasound is able to look at a couple different things too. So it's a little bit different, but it's ultimately kind of, to the patient, pretty similar experience. Um, we start asking about this at some of the first visits because if someone is in the camp where they want to get tested and they want to maybe do something, like they might want to end the pregnancy if there's some problem with this pregnancy, then it's easier to end the pregnancy at the pregnancy being earlier. So that's when someone might choose to do a first trimester screening to know by 14 weeks whether something's going on that they would want to end the pregnancy about. There's also some screening tests that are a combination of the first and second trimester screenings. And then there's also some blood tests where you can test both the mother and father of this pregnancy, both the pregnant person and the partner, if there's any sort of genetic problems that both are carriers of, and that might be at a higher risk of that baby having an outcome of some genetic problems that the parents are both carrying but aren't showing signs of. So that was a lot of information. And I know we took up a lot of the time, so I would love to spend some time answering any questions that came up from that.
Ooh, that was a lot, but good, a lot. Ooh, I'm going to give it to the audience first. Anybody have a questions? And I don't know if anybody in Facebook wrote their questions either. Let me check. Anybody here? I'm going to give it to the chat, people. Did you guys have any questions first? Woo-hoo. Nobody have questions? That's nice. All right. Well, I have a question. So my question it is, let me see, I wrote a lot of questions, but I'm not going to bore you guys since everybody's so scared to have questions. So genetic test, you said that only women who is 25 and above.
So for the cell-free DNA, the insurance covers that test for people who are 35 or above, or if there's a family history or other high risk, maybe in a previous pregnancy, there was maybe a pregnancy loss or a stillbirth, or there's some family history of some sort of genetic problems. That's when insurance covers it. Otherwise, those other options, those other screens, like the first trimester, the second trimester screens, are available to everybody at low cost.
Okay. Any insurance, including like Obamacare?
Yeah.
Okay, that's nice. Taylor wrote, what do you recommend a pregnant mom with a vegan diet consuming most of what food?
So that's a good question. So if we could go maybe back to this plate, maybe not.
Yeah, and I can speak to this a bit too, as a vegetarian. So the elements, like we said, major things are folic acid, which we hope you're on a supplement for anyway, so less concern for that. But things like iron are really hard to get, or can be hard to get in vegetarian diets. So making sure we're prioritizing that. So iron and protein. So things like tofu and tempeh are top recommendations for getting those. And then legumes, nuts and seeds, and then making sure that you're keeping up with the like starchy vegetables. Those are all ways that you can meet those nutritional requirements. But for kind of just to summarize, protein, I recommend tofu and tempeh, and then to make sure that you're getting enough of the iron, making sure you're getting like legumes, and other things would be whole grains and vegetables, the starchy vegetables. That's the broccoli or cauliflower, anything that's like really crunchy, spinach.
Yeah, it's important to make sure you're getting enough protein, like Blake said, and then you can get a lot of iron and other of the important nutrition and protein through vegetables. Like leafy green vegetables have a ton of iron in them, and then combining like rice and beans, legumes, those have a lot of good protein as well that you can get.
The one thing I find is hard for patients practicing a vegan diet is calcium. So there are like plant-based yogurts and elements like that, and just checking the calcium content, and then if needed, a calcium supplement.
Wow, I did not know that. That's awesome. I've noticed that some moms who I work with, they worry about gaining weight. they keep from themselves eating, starving, because they say that the baby's gonna get big, or I'm gonna get big. What do I tell those moms? How do I talk to them?
Yeah, I would say it's important to also gain weight to make sure that the pregnancy is healthy. So it's important to have a regular nutrient filled diet. So it's not all about the weight and the numbers itself. It's also about what you're eating, like we've been talking about, and making sure you have enough of those nutrients that the baby needs. In terms of gaining too much weight, we talked about kind of those ranges of numbers that can be healthy, but it's important that the baby definitely does need some weight gain for sure to grow and be healthy. And we get really concerned when we hear about people not gaining weight at all or losing weight in the first trimester. So that I'm not sure if that helps, if that's
Yeah,
something to pass along.
yeah, I try to talk to them.
Yeah.
It's very hard. It's really, really hard. Sometimes they're just, what about mom who is nausea throughout entire pregnancy? Any particular reason why that is? Any supplement or food she can eat to help with her with that?
Yeah, that is so hard. And
That reminds me of me. Mm.
it's so hard. And it is so, yeah. And morning sickness, we call it morning sickness, but it's not just in the morning at all. So that can be such a terrible sensation and thing to go through. I, we talked a little bit about trying to find any sort of foods, any sort of things that feel a little bit better to try, eating really small amounts but frequently,
Mhm.
making sure to stay hydrated. Sometimes carbonation, like seltzer waters or ginger
Tea.
drinks, ginger teas, ginger chews, ginger everything can be helpful. And then if you're still vomiting a lot, going to your doctor about any medications, but sometimes the vitamin B6 can be really helpful for nausea. And then in terms of the why, we don't really know why some people have these really awful symptoms. We know that sometimes the pregnancy hormone can make people feel really sick, but we don't know why some people have this and some people don't. And it can be different with the same person in different pregnancies. So I don't have a good answer for that. I'm so sorry.
Wow. How about those weird craving? I see women crave some weird stuff, eating some sand or eating some charcoal or whatever, or something.
Yeah, the weird cravings for things that aren't food, that is something that we actually call something called pica, and that can be a sign that you are missing some nutrients. It can especially be a sign of low iron. So, if you're experiencing that, sometimes it can be good to go get a blood test from your doctor, but other times just trying to make sure that you are putting back some iron in your diet. And if you're not on a multivitamin, taking a multivitamin for pregnancy,
Yeah.
um, sometimes people notice it with ice too. So
Yes, oh my goodness. I used to see one of my friends, I'm not going to mention name, but yeah, ice, your Lord have mercy. Mhm. Oh yeah. You talked about caffeine. You say 20 to 200 to 300 milligram. That is a cup. How many ounces is it?
it
Like a
depends
60 ounce?
on the coffee. So Starbucks, like a Starbucks coffee, a 16-ounce Starbucks coffee is something like 350 milligrams of caffeine.
Ouch.
Um, so so that's a little much.
Yeah, it
But
is.
Starbucks has pretty caffeinated coffee,
Mhm.
and some people think it's a conspiracy theory to make you buy their coffee more. But
Yeah. Is
I
it?
think it all comes down to coffee brands will have that information listed
Yeah.
on the back of like a coffee ground bag. And I have
Mhm.
what I recommend for my moms who really love like their cup 4 cups of coffee in the morning is cutting half. So they end up making half calf at home. And that way you can just like get, if it's the ritual of having your cup of coffee without,
Yeah.
you know, overdoing it on the caffeine.
That's nice. And can they take like ibuprofen? No, just the Tylenol?
Yeah, just Tylenol. We recommend avoiding ibuprofen or other NSAIDs, ibuprofen, Aleve, meloxicam, things like that. Just sticking with Tylenol, which can be hard.
Yeah.
All of those medications like ibuprofen and anything called an NSAID can impact some of baby's heart development. So we really avoid that.
Makes sense. So those bunch of lab work you guys do from the beginning, the whole appointment is called a missed period appointment. I learned something new today.
The what?
The whole lab, the first appointment that the mother shows up, the initial appointment. So that appointment is called missed period appointment.
The first appointment before that, if you come in,
the
yeah,
one
if you,
before that is missed period appointment. So the following that one, the one they do the bunch of lab work and all that
Mhm.
stuff, that is your initial appointment.
yeah, we call that the initial prenatal appointment.
Initial prenatal appointment. Okay, got it. Got it.
And the one thing we didn't emphasize is that that first appointment, the missed period appointment or pregnancy confirmation appointment, is really our opportunity to sit down with our patient and you know, the woman sitting across from us and just have a conversation about whether or not this is a wanted pregnancy, and if it is, what our next steps are, and if it's not, what our options are as well. So we really avoid kind of thinking that as like a pregnancy appointment and more of like, okay, you've missed your period. Let's go through the steps of what our options are. So I do want to put that plug in of that's something we talked about. And then sort of a similar vein, one thing we didn't touch on today are miscarriages. And they're incredibly common. You know, 1 in 3 pregnancies will end as a miscarriage, and yet there's still you know, there's a lot of thoughts, you know, feelings of shame, and there's a lot of social kind of disregard for that experience or that, you know, what that is. And it, like we said, it's incredibly common. So many of our patients have experienced that. And it was just such a big topic that we chose not to go into that today, but we wanted to put that out as an option of if that is something people are interested in, we could include that in our next conversation.
You talk about miscarriages,
Okay. Okay. So we'll be sure to include that at our next talk. I think that is it's a very valuable conversation, and we wanted to do it justice.
Definitely. We're going to talk about miscarriages.
I think that's a whole talk. I think it's a whole
talk,
own talk. And so maybe next time we can talk about first trimester miscarriage. And then we can continue on with the second trimester of pregnancy. And thank you for saying all of that, Blake. I think we focus this talk on this being a desired pregnancy first trimester, and that if it's not a desired pregnancy, then we can also have those conversations of that's a whole conversation and a whole topic as well. So so that's kind of the framing we chose for this talk.
Definitely. Yeah, no, definitely. I wrote it down and I'll remind you guys too. We can talk about that next month.
Perfect.
Fabulous. Any last question before I let these wonderful doctors go, ladies? I can end Facebook right now. Let me end that. I think everybody is set, and I thank you very much, ladies. I don't want to hold you this beautiful sunny Saturday. What's left, please enjoy it, and I thank you for coming out. I will see you next month.
Thank you so much.
Thank you very much.
Thank you for the opportunity.
You guys, and nice to meet you, Blake.
Yeah, you too.
Bye, guys.